Hello, everybody. My name is Savannah Elliott with Adams Dental Consulting. Thank you for attending today's webinar on the introduction to regulatory compliance in the dental practice. Let's go ahead and get started. I'm going to jump right into regulatory compliance, what the various aspects are of it, and how you can safeguard your office and to make sure that you are protecting not only yourself, but your team, the environment, and reducing any potential for, fines or penalties. So before we begin, a little bit about myself. I come from about 10 years of dental industry background, ranging from management to working with the Dentist Insurance Company, which is a subsidiary of the California Dental Association. There I was the compliance and quality control manager and oversaw risk management and various aspects of regulatory compliance overall. And so that led me to working with Adams Dental Consulting. Here I oversee our remote billing department and offer CE trainings for dental practices. We are a full service consulting company. It ranges from practice management consulting to offering marketing services, remote billing, as I said, and CE offerings for yourself and your team. All right, let's go ahead and begin. All right, so when we talk about regulatory compliance, what does that mean to you? There are so many different rules and regulations that a dental office has to adhere to. But with any organization or business, regulatory compliance means that you have to adhere to laws, guidelines, specifications, anything that's relevant to the nature of the business itself. As a business owner and a dentist, you're going to be required to comply with a number of federal, state, and local regulations. So it's really important that you know what they are and what the consequences are if they aren't carried out correctly. An overview of some of those requirements that you are required to comply with: the Dental Practice Act, occupational safety, infection control, employment, environmental, and patient privacy laws. The Dental Practice Act is the body of laws in California Business and Professional Code and the California Code of Regulations that governs dental professionals. This could include dentists, oral surgeons, orthodontists, dental assistants, and dental hygienists. The Act is intended to serve as a legal guideline for both the professionals and the public regarding all aspects of the dental practice. The list that we are going to cover is not exhaustive, and each item might not be applicable to every practice. As we continue through this webinar series, we will get into greater detail for all the various regulatory compliance concerns. And today we will cover just a high level and few examples of what they might be. The Dental Board oversees the health and safety of consumers in the dental practice, and this is accomplished by way of enforcing the Dental Practice Act. The Dental Practice Act contains a wide range of information, anywhere from the structure of the dental board, the governing bodies, the utilization and scope of practice for auxiliary duties, laws that govern the prescription of drugs, citations, fines, revocations, mandatory reporter status, license renewal, advertising guidelines. The list again goes on and on. And so as we get into a few examples of what you might see in the Dental Practice Act, let's talk about advertising. So one of the very exciting things and business decisions that you have an opportunity to make as a practice owner is the name of your practice. There are regulatory requirements involved when you make the choice to change the name of the practice or use a fictitious name. By understanding the regulations that are set forth in the Dental Practice Act regarding these changes, you're going to reduce any chances of violation and subsequent penalties. So for example, maybe the practice name, the current practice name for your office is John Doe DDS. However, you wish to change it to Smiles R Us, Dental Practice of Dr. John Doe. So we're going to walk through how you might be able to do this. One would first need to apply for a fictitious business permit because the name is different than the name under which the license is issued or a dental corporation name. After you've applied for the permit, you would then file a fictitious business name statement with the county clerk. Now, it's important to know that the fictitious business name also must include at least the family name of the applicant or one of the applicant's prospective associates, partners, shareholders, or members of the group. As well, it must have one of the following designations: dental group, dental practice, or dental office. You'll see here there are a few examples that are listed. You've got Greenhaven Dental Care, Dental Office of Dr. John Doe, or ABC Dental, Practice of Smith Dental Corporation. Both of these have dental office or dental corporation listed there with the dentist's name or the owner's name. Every county might have different forms to complete or different filing fees that are required, so make sure you contact them ahead of time to get all of the necessary information before you waste your time driving down there and not having everything that is required. Another aspect of the Dental Practice Act that you will find is auxiliary duties and understanding various aspects of what's permitted and what may not be permitted, or the various supervision methods that are appropriate. Some of the provisions covered in the table of permitted duties relate to understanding the difference between direct and general supervision. Understanding when treatment can be performed when the dentist is physically present versus not being in the office. Direct supervision basically means that the dentist is required to physically be in the treatment facility during the performance of the procedure. And then you have general supervision. This means the dentist is not required to be physically present in the treatment facility. So maybe the patient had already been in the office for an exam with the dentist who has diagnosed treatment that can subsequently be performed by a dental hygienist. If it is a procedure that only requires general supervision, the hygienist can perform the treatment without the dentist being in the building. If you take a hygienist, for example, who is authorized to perform the following procedures under direct supervision of a dentist, you'll notice that the administration of local anesthesia does require direct supervision. And more oftentimes than not, administration of local anesthesia is required when scaling and root planing is performed. Therefore, if you are looking out at a time where maybe you want to take some time off, however you'd still like your office to continue to work, you just need to make sure that if a hygienist is going to be working without you in the building, that you have scaling and root planing performed when you will be back, or you are making sure that you're able to use other anesthetic requirements for those patients, because they will not be able to administer the anesthesia without a dentist in the office. So by knowing this information, you're able to determine the best scheduling template or adherence to time off for you in your office. And this is going to range not just from hygienists, but from dental assistants too. RDA EF has some extended functions that they are allowed to perform as well. And so looking at those table permitted duties is really going to help you understand what your staff can do and what they cannot do. One of the largest categories of compliance lies within the scope of infection control. Infection control is largely regulated by OSHA, which is the Occupational Safety and Health Administration. They are responsible for worker safety and health protection. However, there are other entities that play roles in infection control. You're going to see some of them listed here. The Centers for Disease Control and Prevention, CDC, is responsible not only for workers, but for the overall public's health. Within the CDC is the National Institute of Occupational Safety and Health, where OSHA is responsible for the enforcement of workplace safety. The National Institute for Occupational Safety and Health is responsible for improving workplace safety. They do this through research, education, and training. The Environmental Protection Agency, or the EPA, they have an interest in hazardous waste and drinking water standards. State and local public health authorities have regulations that might be more stringent than federal standards. It's best to err on the side of caution with whichever standard is going to be more stringent and to follow those guidelines. As previously mentioned, OSHA oversees occupational safety. The responsibility of ensuring that the staff at the dental office is safe and uses correct precautions is going to be regulated by OSHA. By ensuring all your staff have proper training on personal protection use, instrument use, emergency plans, etc., you're really going to reduce the chances of any injuries or the severity of an injury and a potential OSHA violation. OSHA violations range, in cost depending upon the frequency and the severity of the violation. Many common violations that we see pertain to improper training or use of personal protection equipment, or PPE, as well as hazard communication plans. Now, the plans that an office have need to be very specific to your office. They need to indicate emergency exits, where your safety data sheets are, where to locate them, who to contact if you have an injury, where to go if you have an injury. And so it's really important that not only new staff coming into the practice, but that you have reoccurring reviews of these plans so that you can reduce the likelihood of an injury or a violation, which can be very costly on a practice. An example of proper training of equipment use is an eye wash station. It's not only important that your office has an eye wash station, but what's more critical is that all your staff know where to locate the eye wash station and how to use it. I have seen a number of practices that have beautiful new equipment, and unfortunately, because they don't get used very often, not a lot of the staff know how to use it. And this is going to be a really big issue in the event of an emergency. Making sure that the hot water is not turned on for your eye wash station, the location of the eye wash station, and how to properly use it is going to be a part of your plan, your OSHA plans. So any new person coming into the practice needs this information and a review for current staff as well. Following some compliance regulations, we're going to talk a little bit about employment regulations. Your staff at your office face the nature of the possibility of being injured, whether this is, a needle stick or a trip and fall or an RMI sort of injury. They need to be, protected. And one of the ways to be protected is through workers' compensation insurance. Workers' compensation insurance is required by law. You need to make sure that if you just purchased a practice or opened a practice from the ground up, the day that you hire that staff and they begin working for you is the day that you need to have workers' comp insurance. You want to make sure that you don't have any sort of gap in coverage if you're switching carriers or just obtaining it for the first time. There are some required posters that you need in the dental practice, Cal OSHA posters, and these notices do have sections where you can indicate who your workers' compensation insurance company is, the phone number that they can contact if they have an injury, and where they can go, or who to call and report this to. And that's just one of the small pieces of employment regulations within the dental practice. There are many, many others as far as making sure that all of your professional staff are licensed. There's been no expiration to their license, so on and so forth, that we will continue to dive into further into this webinar series. Now, when we talk about the EPA and environmental factors that go into regulatory compliance, a dental practitioner should recognize the importance that some of the materials and the procedures that we use in dental health services could present challenges to our environment. To help reduce any sort of risk or uncertainty about how to manage hazardous materials, we definitely recommend hiring a reputable company that specializes in the professional handling, transportation, and disposal of EPA regulated waste. Another resource that you have at hand to you are your safety data sheets. Any hazardous material should come and be shipped with a safety data sheet that has 16 sections for you to understand what you're handling, how to store it, how to transport it, how to dispose of it, what the hazardous impacts are of it, so on and so forth. If it is not shipped with your material, most manufacturers have this information available on their website that you can download or print as well. Patient privacy is regulated by the Health Insurance Portability and Accountability Act, otherwise known as HIPAA. HIPAA laws ensure that all the protected health information of your patients remain confidential and don't go outside of who they authorize to receive it. Any failure to comply with HIPAA laws could really hurt the reputation of the practice, of all parties involved, and could result in costly lawsuits. If HIPAA rules are violated, fines can go up to $250,000 per violation. A lot of offices have a HIPAA officer that they have oversee any potential risks in the office for HIPAA violations, to enforce safeguards, as well as an OSHA officer, just to help ensure that the office is being as compliant as possible. This HIPAA officer, could be your manager if you only have a one front office person office. It could be them, it could be a dental assistant, it could be yourself. So as long as you understand what those laws and regulations are and you are able to enforce them in the office. So we're going to go through a few of those safeguards that you can utilize in the practice to make sure that you are doing as much as possible to ensure the confidentiality of your patient information. You can utilize a HIPAA authorization form, and what this form does is it allows you to disclose patient information as needed. However, you cannot disclose this information unless the patient gives you authorization to do so. We suggest utilizing a HIPAA authorization form for this. There are some elements of the authorization form that you must use. We'll go through them here. There needs to be a specific and meaningful description of the information to be used or disclosed. The name of the person authorized to request the disclosure must be on the form, and a description of the purpose of the requested use. It could be as simple as at the request of the individual. That's a sufficient description. There also must be an expiration date of the authorization. Now, this expiration date doesn't have to be a specific date. It could indicate none, as in this is good forever. At the end of a research study, it could be 1 year from now. you know, the choices really lies with the patient of how long they want that authorization form to remain intact. And then the patient needs to sign and date the form as well. If it's signed by somebody other than the patient, a representative of the individual, maybe a parent or somebody who has power of attorney, a description of that representation must also be indicated. The authorization form must also include a statement regarding the individual rights to revoke the form. Here you're going to see an example of an authorization form that ADC has created and has distributed to some of our clients. You will see that all of the content in here has the required information. We suggest keeping these forms on hand in the practice where you can pull it out if the patient's in the office and have them complete it. You may fax or email it to them so that they can return it to you signed and fully filled out, and then keeping a copy of this in their patient chart as well. There are many, many, many other safeguards that you can use to prevent the exposure of patient health information. Some of those are by use of restricting some of the views on your practice management software. There are various views, some of them specifically say HIPAA view. And what they do is reduce some of the information that's displayed on the screen. Social security numbers, full names, first names, last names with the date of births, all of that might be removed so that in the event of where a computer is visible to other people in a reception area or in an operatory, there is no potential for the information to be disclosed to somebody other than them. And these are just a few examples of some of the regulations from HIPAA and how to safeguard yourself and your office from them. Again, this is a high-level overview of regulatory compliance in the practice. This list is not exhaustive. There are many, many other regulations that we will cover and a lot of safeguards that we can give you advice and tips on how to protect yourself in your office. So thank you so much for listening today. The information of how to contact us is displayed here. You can call or email or find us on socials and send us a direct message. We'd be more than happy to get back to you and really look forward to talking to you again later in our webinar series. Thanks so much, everybody.